Patient says that her skin keeps getting darker, but she hasn't been in the sun. Then you get an EKG and you see it is absolutely crazy. So what is going on here? This is an NCLEX case study. I'm going to give you a presentation, vital signs, physical exam, and labs. You are going to guess the most likely diagnosis and then answer 3 questions based on that diagnosis. So this is a 24-year-old female Caucasian patient who presents to the ER with extreme fatigue, dizziness, and she's had an 18-pound unintentional weight loss over the last 3 months. Her vital signs, pertinent vital signs, are blood pressure of 88/56. This is low. Heart rate 114, a little bit elevated. On physical exam, not only is her overall skin darker, but it is darker over her knuckles and in her mouth as well. Pertinent labs, sodium level is 129, which is low. Potassium is 5.5, which is high. And blood glucose is 62. That's borderline low. Based on labs, physical assessment, vital signs, presentation, and then what she looks like, what disease do you think this patient has? You will answer in 3, 2, 1. This is Addison's disease. Addison's disease is a primary adrenal insufficiency, meaning the adrenal glands on top of the kidneys become damaged. Usually this is from some kind of autoimmune process. So the adrenal cortex, the adrenal's job is to make our stress hormone like cortisol and our aldosterone, which holds in salt and water. So without aldosterone, if it can't hold in salt and water, then it lets out salt and water. And that's what gave her the extreme low blood pressure, right? Because you're going to lose fluid instead of being able to hold on to it. It also will give her the hyperkalemia because if she's losing salt, she will hold on to potassium. She's going to come in very, very dehydrated with that low blood pressure. They usually get a lot of weight loss. They can sometimes even have hypoglycemia, and we're borderline here, all right? So just question number 2, your patient presents with this EKG as you are examining her. What do you see is going on in this EKG? You have 3 seconds to answer. 3, 2, 1. This is classic for hyperkalemia because there are peaked T waves. The peaked T waves usually mean hyperkalemia, which matches up with her high potassium here, all right? All right, next question is, what is the treatment for Addison's disease? What is the immediate life-threatening thing that we are looking at here that needs treatment? You will answer in 3, 2, 1. We are going to give them IV hydrocortisone since they are missing their cortisol and aldosterone. Okay, cortisol, corticosteroids. Corticosteroids have cortisol and aldosterone in them. So we immediately need to give IV hydrocortisone. Last question. What type of IV fluids would you give this patient rapidly because their blood pressure is almost at shock level? You have 3 seconds to answer. 3, 2, 1. We are going to give normal saline plus or minus